Welcome back and welcome to part 3. We're going to move on and look at levels of prevention. If we look at prevention or preventive measures, we look at 3 levels. These 3 levels include initiatives or preventive measures to address diseases at specific points in their progression. With primary prevention, we focus on health promotion and illness prevention. Essentially here, we're trying to remove any risk factors that may be present to the patient. This may include education and immunizations. Secondary prevention focuses on diagnosis and treatment. It is helpful in detecting and treating problems for patients when they are asymptomatic. This could include screenings and care for acute disorders. With tertiary prevention, this focuses on rehabilitation, restoration, palliation, or increasing the patient's comfort to maximize their full potential and limit complications of a disease process. This could possibly include speech therapy or physical therapy following a stroke. So I want to talk a little bit about how we are going to be looking at diseases in this course. We will be working through the disease process through a concept-based approach. To think conceptually is the ability to understand a situation by identifying patterns and addressing key underlying issues. Concept-based learning is an approach to learning that brings real-world meaning to that content. It will help you make connections and link factual information and exemplars to the concepts. So essentially, concept-based learning is an educational method that focuses on the big ideas and teaches how to organize and categorize that information. Simply just teaching the content only focuses on facts, while the concept focuses on making sense of those facts and the world around us. Instead of the traditional method of learning, which concentrates on the ability to recall specific facts in isolation, using this concept-based learning method, it helps to concentrate on the understanding of broader principles. Those broader principles, called concepts, can be applied to a variety of specific examples. It's really going to help you and challenge you to think more critically about the new subjects and situations that you encounter by applying prior knowledge and experience. You have to think beyond the facts and connect that knowledge, that factual knowledge, to ideas of conceptual significance and find that relevancy. We will take a look at various concepts through this course: oxygenation, elimination, perfusion, homeostasis, comfort, and we will also focus on integrating those concepts. This will help you in the future. It will enable you to use what is familiar, what you have already experienced, to better understand new subject matter. It will help you develop your own clinical framework that teaches you how to draw conclusions about new patient situations throughout your time in this program and then throughout in your career. As I mentioned on the previous slide, we will be looking at interrelated concepts, how one concept directly or indirectly affects another concept. This can be applied to many disease processes and alterations in health. Very simply put, we could say that perfusion can affect elimination, right? If we have a problem with perfusion, our kidneys do not get enough blood flow, oxygen, nutrients. Therefore, they're not going to be working properly. Therefore, we have complications with elimination. This slide illustrates the concept of functional ability positioned in the center as the focus for learning. The concepts of cognition, sensory perception, mobility, and coping represent those interrelated concepts. Interrelated concepts are concepts which either affect the concept of focus or are affected by the concept of focus. For example, A patient with good functional ability must have the capacity to perform actual and required activities for daily living. However, if one or more of those interrelated concepts are not functioning adequately in the patient, functional ability cannot exist in the patient at its optimal level and will require an action from the nurse. We will eventually be combining multiple concepts into integrated processes, and you will need to bring all of that information together. So as we begin to think about the different concepts as we move through the course, begin to think as you learn more and more about new concepts and new disease processes, how that prior concept or other concepts are directly related to that. So you have a wide, thorough, deep understanding of these disease processes and the nursing care that is associated with it.